Hi everyone, I have a quick Friday update for you. I wanted to mention just a few random things again. The first thing is that I want everybody to be aware of an issue that has happened a few times. When our patients are coming from the OR to us, mainly this affects our heart patients. Sometimes anesthesiologists are placing extension tubing on the art lines. And what happens is when you use the vamp to draw blood, it doesn't pull enough blood back, and so we are getting diluted blood samples. So Alicia has spoken with someone about it and has asked the anesthesiologist to please stop doing that. However, just be on the lookout for that. So you might get some altered lab results if you're not careful with it. So if there's extension tubing on the art line and you want to be able to draw from that art line, which I think we do, then you will need to change the art line set on that patient. And that just takes a little bit of care because it's very easy to pull those art lines out when they're not sutured in. So that's one thing to be aware of. Another thing that has come up a couple of times is at 4 a.m. our blood gases and chest x-rays. Things are very busy throughout the whole hospital, and sometimes for whatever reason these things are kind of getting missed a little bit. So please be mindful that if you have blood gases and chest x-rays due at 4 a.m. and you're noticing that they're not getting done, please just make a call to those respective departments and give them a little reminder that we need to have them done. It's just that it's happened on kind of a handful of occasions. They're still getting the orders. People are just busy. So we can give them a little friendly reminder. I want to let you all know that Michaela has graciously volunteered to take care of our jacket order for this year, and she has picked out some great samples. So there's some samples in my office. You can ask the charge nurse to open the office. Not every size is available, and the color is royal blue in the samples. However, the jackets will actually be navy blue from what I understand. Double check that with Michaela. And then there is an order sheet that you can fill out on my office door as well as Alicia's office door. So ask the charge nurse if you want to take a look at those samples so you can feel what the material is made of, and then put in your order for jackets. Thank you, Michaela, for doing that. And then one thing to be aware of, the fleece jacket, this has always been the case, is technically not in dress code. So just to be mindful of that. We don't tend to point out dress code violations too much around here, but just in case for some reason it kind of comes up and happens, that fleece jacket is not technically in dress code. And then one last thing, we've talked about this before several times, is keeping the doors to our COVID and PUI rooms closed. And then also wearing correct PPE and wearing masks while we're at work in the hospital. I want to draw your attention to this again. I know you've heard it 100 times. What's happening is some people from other departments who are not clinical employees will sometimes walk by and see an open door and they become very afraid. So I want to point it out again. Please try our best to keep the doors closed to those rooms. Wear the correct PPE. That's a no, like we have to do that. This is COVID times. We're not messing around with PPE anymore. We need to wear the correct PPE when we go in the rooms. But the doors being closed, I know sometimes it feels a little nitpicky, but some people are walking by and they become very afraid that they might have been exposed to something in that room. So we have to be mindful of them as well and keep those doors closed. So please do that. The other thing, last thing, sorry, I wanted to tell you is that I'm working very hard to try to find additional help for our team. I know everybody has been working very hard lately and that we have lots of shifts where we're tripled, and this isn't a pandemic. It just sadly, it's a tough time, but I want you to know that we have some relief coming. We have more agency nurses coming to help us, and we are working hard to try to hire as many people as we can and hire some agency nurses to come help us. So I just want to say thank you again. You have been working so hard. I want you to know that we are trying really hard to get some team members in to help us, and I think we will start to see some people kind of come in and help relieve some of this. But thank you, everyone. Thank you again. And we will go back to our grid. I don't want anybody to feel worried that this is the new norm. This is a pandemic. This is not the new norm. We will go back to our grid, and one day again we will have open nurses and a task nurse working. That will happen. We just have to deal with this increased census in the meantime. So thank you, everyone. I hope you have a wonderful weekend.